Hello, good afternoon. Is your favorite school psychologist, Nwaebiem-Your. So this afternoon I would like to talk about something you might have noticed, but maybe you couldn't place your hand on it. At the beginning of every term, I like asking my new students their hobbies. And last section was very peculiar. Out of quite a number of students I asked their hobbies, many of them said it was video games, watching movies, things like that. So it didn't take quite long for me to start seeing some strange behaviors, and that was when I started researching, and I found out that there is a term, though informal, but scientists have started making research on it, and I want to bring it to your notice this afternoon. So what is it? Virtual autism. You know, when you Google the word virtual autism, you will first, Google will first give you options of having your autistic child diagnosed virtually. But if you dig deeper, you will notice that virtual autism assessment and virtual autism are not the same. So what is virtual autism? Virtual autism is an informal term or condition that is believed to occur in young children, especially 3 years, older than 3 years, that are exposed to excessive screen exposure. You know, nowadays, most parents use screen to babysit their children. As much as it gives them time to do what they want to do, it is not really a wonderful thing. This virtual autism is as a result of excessive use of screen time. If you notice, in today's world, social interactions are becoming a problem, communication is becoming a problem, all because we have individuals who are lost in the world of gadgets. I remember coming into a particular environment. We were seated waiting for something, and I looked around and I noticed that everybody was engrossed in their gadgets. So face-to-face interaction, communication, bonding is going into extinct as a result of what? Virtual autism. And when I tell you virtual autism, I don't mean autism spectrum disorder. You know, the same way pineapple is not an apple, is the same way virtual autism is not autism. It is simply autistic-like behaviors that are as a result of increase or excessive screen time. What are these autistic-like symptoms? Impaired social skills. People cannot connect or relate with each other as a result of being engrossed. So people don't learn face-to-face human interaction anymore. So impaired social skill, language and communication skill. I think I've had a case where a child was brought in about around 5 years, and she was having speech delay. So by the time I asked a few questions, I noticed this is not a speech disorder or autism or anything. This is as a result of excessive screen time. So language, impaired language skill, communication skill. So when you limit face-to-face social interaction, non-verbal cues, maintaining eye contact, using appropriate facial expression, difficulty building and maintaining relationships occur. So another symptom is sleep disturbances. These as a result of engaging excessively. Have you ever noticed that particular night when you would want to sleep, but you have watched or looked at your phone a lot, you experience a kind of insomnia? That's as a result of what? Exposure to excessive screen. So that's prolonged exposure to screen. Then maladaptive behaviors like aggression, irritability, impulsiveness, and other behavioral issues, depression. These are things that excessive screen time can cause. Then attention difficulties. So you talk of impaired social, language, and communication skills, you talk of sleep disturbances, you talk of maladaptive behaviors, and you talk of attention difficulties. So what do we do? I would like to say again that virtual autism and autism spectrum disorder are not the same. The same way pineapple and apple are not the same. So virtual autism is as a result of extensive exposure to screen time, but ASD is a neurodevelopmental disorder. That simply means it is present at birth. And virtual autism can be cured, while ASD has no known cure for now. So by way of intervention, there are a few things we can do if we notice that a child who is not diagnosed with ASD but is displaying symptoms of ASD. So there are things that we can do for that particular child as a way of intervention. One of the main things to do is to reduce screen time. Of course, that's the main thing. Reduce screen time. Another thing you can do is to increase quality engagement, be it social, any form of engagement, engaging them with intellectual and sensory stimulating activities. It helps a lot. Another thing you can do is to introduce interactive games, imaginative games, play pretend, things like that. Then talk with your child. See, I've noticed that one of the reasons why our children spend so much time with their gadget is because they are learning from us. If you as a parent spend time, you won't really have time to engage that particular child. So talk with your child, talk with them, communicate frequently, reduce the yes or no questions, focus on interactive questions, ask, wait for their answers, listen to them. Another way of helping is to encourage your children to make friends. Encourage them to make friends. Allow them to participate actively in taking care of themselves. In that way, they are learning self-care skills, they are learning social skills. Again, make it a habit to walk them out. Let them go out, enjoy nature, play with things in nature. It helps. So visit parks, visit the seaside, things that will help them to interact with nature. And encourage them to do more of reading, reenacting emotions. It helps them in emotional regulation. It helps them in naming their emotions and things like that. Again, in severe cases, there is need for therapy. So I encourage us, prevention is better than cure. Before they get so immersed in gadgets, help them to learn communication, social skills. Make sure you are not even the one driving them to virtual autism. Until then, have a very wonderful day. Is your favorite school psychologist, Nwaebiem-Your. See you next time.